You might have heard of peripheral neuropathy, but unless you know someone who lives with it, you probably don't know much about it. We're going to change that this morning with Dr. Patrick Sartz from AZ Neuropathy Centers, here to fill us in and kind of fill in the gaps on this issue. Nice to see you, gentlemen.
Thank you for having us.
Now, I know that you've mentioned in the past that there are a lot of people who do suffer with neuropathy. So let's talk about what it is and how you know if you have it.
Okay. Generally, when people think of peripheral neuropathy, they think of diabetics. And it affects about 60% of all diabetics, but they actually only compromise or come up with about 30% of the people that suffer with it. There's over 100 known different causes. Initially, what people will feel will maybe be some numbness or tingling in their feet, or maybe nothing at all, except that they'll lose their balance when they close their eyes when they're washing their hair in the shower because they've lost awareness of where their feet are at. Unfortunately, it progresses and it can become quite painful, that they can get sharp shooting pains, burning, their feet feel constantly cold, and it can reach the point where just being on them can hurt so intensely that people just sit down and end up in wheelchairs because of it.
Well, that's debilitating, and it's probably not necessary considering there are new treatments. But before we get to the new treatments, tell me what we've done up until this point and how that has now changed.
Good. Stephanie, up until this point, people have been told you got to learn to live with it, or there was a surgical procedure that they tried quite often, but it wasn't very effective. And then, of course, you can take the psychotropic drugs. The psychotropic drugs make you comfortable, but they don't fix the problem. So the fire rages on, but the alarm's turned off.
Now, let me ask you this, too, because I would imagine that this is sort of new. People are accustomed to, just try and take those drugs and make it work. What has been the greatest challenge getting people to embrace this new technology and this new way of addressing neuropathy?
That's the neatest part. The new technology has only been around since the early 2000s, okay? In fact, our research goes back to about 2002. We use a combination infrared low-level laser system. We use vibration therapy. We use cutaneous stimulation. And all these things are things we've compiled from either Russia, China, Italy, Australia, and so forth. And the most frustrating thing is it's new. And so people don't know about it. And a lot of docs out there, if it's not their specialty, they haven't kept up with it. And darn it, they poo-poo it. And the problem is that we're getting 90% results. 90% of the people say that they're 75% or better in their symptomatology.
That's huge.
Fantastic.
Anybody would take those odds. Now, how did you get involved in this back in 2002 or earlier than that?
Well, in all actuality, Dr. Paul got involved in the fact that he ended up getting a shard of glass stuck in his foot. Thought the dog got hurt because there was all this blood on the kitchen floor, and it was actually him, and he didn't realize that he got hurt, so that he actually had neuropathy himself.
Yeah.
I got involved because of the fact that my mother suffered with neuropathy for about 32 years, and it progressed throughout times to the point where she was pretty much bedridden by the time that she passed away, and there was nothing out there that we could do. And so I've always looked at everything that treated neuropathy, and basically up to this point that we discovered this, nothing worked, and this worked. And I didn't believe it initially, that I was the most skeptic person in the world, but the first patient that I ever treated actually called me the following day and told me that she had gotten up that morning after one treatment, which generally does not happen, and walked across her tile floor pain-free for the first time in 15 years.
Wow. This from the same type of patients that can ultimately end up in a wheelchair.
Exactly.
So how is it that you're able to have such great results and yet still have so many people that are a little bit, concerned and precautious?
Well,
and what can we do to reverse that?
Well, education.
Okay.
And the people that have been through the system and have gotten good results can come out and tell people about it. Now, here's the other thing. People will come in and they'll say, oh, we tried the cold laser before. Well, dang it, the cold laser isn't sufficient. You've got to have different wavelengths. You've got to have a particular protocol that you use, and you got to rehabilitate the nerve. You can't just shine a light on it and hope it's going to come out fine. There's a whole bunch of stuff you got to do, and you're not going to get it anywhere other than one of our treatment centers.
Well, we're going to make it easy for people to get to your treatment centers.